We're now live. You can go ahead.
All right. Well, thank you all for joining us this evening. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and I thank you all for joining us for this special joint community town hall briefing with the Sonoma County Office of Education. And our goal today is to address COVID-19 vaccines for children and to answer your questions. But before we begin, let's start with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Well, thank you, Gilbert. As I said, our focus tonight is to have a forum directed primarily at parents of Sonoma County school children and for those under the age of 18. And so for over the next hour, we look forward to sharing the latest information we have about the pandemic and fielding your questions about the vaccine. So to pose a question, please email it to publicaffairs@sonoma-county.org. That's public affairs, one word, @sonoma-county.org. If you're watching this on Facebook, you can post your questions in the comments area below. And we thank you all for those who sent in questions in advance. And we'll be trying to get to as many of your questions as possible. But first, let me introduce Dr. Steve Harrington, Superintendent of the Sonoma County Schools, who has to give us an overview of all the efforts to get our children in class and schools vaccinated. Steve?
Thank you, Paul. I'm going to share a small slideshow with you to address some of the issues as it relates to the pediatric vaccines. The pediatric vaccine clinics are the result of a partnership between Sonoma County Office of Education, SCO, and Sonoma County Department of Health Services and the Sonoma County school districts that offer to host clinics. School-based clinics will be offering the Pfizer vaccine, which received full approval from the CDC for children ages 5 to 11 on November 2nd. While children ages 0 to 17 are at lower risk of severe illness or death than older people, more than 5 million children in the US have tested positive for COVID-19 since the pandemic began, and at least, unfortunately, 805 have died. The vaccine provides a broad defense against COVID-19 and effectively neutralizes the Delta variant in young children. The pediatric vaccine is a specialized vaccine for children and includes a lower dose, a third of the dose given to adults and teenagers. The dose size was chosen to strike the right balance between providing strong immunity and limiting side effects. It was found to be nearly 91% effective at preventing COVID-19. It is given via smaller needles for smaller arms. Practical benefits of the vaccine. There have been more than 2,000 COVID-19 related school closures nationwide since August, affecting more than 1 million children and 68,000 teachers. Most school closures affected a disproportionate amount of socioeconomically challenged children and children of color. Most importantly, there is no need for a vaccinated child to be quarantined. This is the best benefit we can provide. There will be less disruption to school and work, and in-person learning will continue at school. Our goal in Sonoma County is to have schools vaccinated at 80%. This will help reduce the use and frequency of masks and will create a greater stability in the classroom. How to get a free vaccine. It's easy, and we recommend everyone begin by talking first to their healthcare provider, who can answer your questions and provide the vaccine. We are offering school clinics, which started the week of November the 8th, 2021. And you can find a listing of all the school sites and the dates at scoe.org, sco.org /vaccines or /vaccines. The intent is to offer the vaccines to school site students and families who may not have access to either a primary family doctor or have transportation limitations. However, there is a vaccine available that if you show up to any school site and vaccine is available, no one will be turned away. Our goal is to get Sonoma County vaccinated. Since 1995, California has mandated that school-aged children be vaccinated against 10 vaccine-preventable diseases, including measles, mumps, and polio. The result has been that measles, for example, has nearly disappeared. On October 1st, 2021, Governor Newsom announced a future mandate for children, students in California to receive the COVID-19 vaccination in order to participate for in-person instruction. The COVID-19 vaccination would be added to the existing list of 10 required vaccinations for school. This applies to private schools, public schools, and charter schools. There is no immediate impact to students for Governor Newsom's vaccine mandate for children 12 to 17 years of age. Students, let me read this again to you. There's no immediate impact to students. Governor Newsom's vaccine mandate for California for 12 to 17-year-old students does not take effect this year. It doesn't take effect until July 1st, 2022, depending on the full FDA approval for the children in this age group. The mandate for children ages 5 to 11 will occur after full FDA approval, sometime in 22-23. County Health will now review in more detail the science and the parent outreach orientation that is occurring to present the information throughout the county. Paul. I guess we're going to Dr. Mace.
No, thank you, Steve. Yes, we are now going to go to Dr. Sundari Mace, our Sonoma County Health Officer, to give us a quick overview of where we stand with our COVID cases. Dr. Mace?
Yeah, Paul, hang on a second. I need to find the draft that was sent to me for the comments. I haven't received it.
Okay. All right, let me, Ted, can you send it to Dr. Mace again? Or just send it to her? I can send you the link as well.
Yeah, I think I found it. Just one sec.
No worries.
Thank you. Okay, great. All right, thank you so much, everybody. Thank you, Paul. I want to give an update on where we are. We stand at a very important juncture of the pandemic this evening. Last week, we were finally able to begin offering 37,000 children in Sonoma County a safe and effective vaccine that will protect them, their families, friends, and teachers from the worst effects of COVID-19. It comes not a moment too soon. At the end of October, we saw a concerning rise in COVID cases in Sonoma County for the first time since the summer Delta surge. While that eased somewhat during the first week of November, we're worried that we'll see another surge as we head into winter. As the weather cools, we know that more people will be spending time with others indoors, where this virus spreads especially fast. We know that more people will be gathering with family and friends over the holidays. And we know that 1 in 5 people who are eligible for the COVID vaccine in Sonoma County have not yet received their first shot, leaving them exposed to a highly contagious virus that preys on the unvaccinated. Let's put this in perspective. Every day in Sonoma County, we discover 11 new cases of COVID per 100,000 residents. That's about 55 new cases a day. More than 3 out of 5 of those cases involve people who are unvaccinated. The most seriously ill will end up in the hospital. On a typical day, there are 20 or more people in the local hospital beds battling COVID. And sadly, some of them will die despite our best efforts to save them. That is why it's so important that we vaccinate ourselves and our children as quickly as we can. I want to give you an update on the spread of COVID in our schools. Since classrooms reopened in August, we have detected 876 cases of COVID among students and staff. Nearly 9 out of 10 of those cases are among students, and at least 100 are the result of on-campus transmission. Let's put those numbers into context. Children 17 and younger have accounted for 26% of our COVID cases during the past 2 weeks. 26%, even though they make up only 19% of the county's population. That is concerning. And because children are more likely to be asymptomatic, with no symptoms, that is, than adults, they can spread the virus to others unknowingly. That is why the Centers for Disease Control and Prevention is urging every child over the age of 5 to get vaccinated as soon as possible. We don't want our children to get sick, and we don't want them to infect others who may be more vulnerable to severe illnesses. I know some of you may think that your child does not need the vaccine because you've heard that COVID only poses a threat to the elderly and people with underlying medical conditions. That is a myth. While severe illness due to COVID-19 is uncommon among children, they can become very, very sick. Unfortunately, 12 Sonoma County children 17 and younger have been hospitalized with COVID-19 complications since the start of the pandemic. 8 additional children have been hospitalized with multi-system inflammatory syndrome, a serious COVID-19 related condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. You'll learn more about this pernicious disease later this evening. I'm going to keep my comments brief tonight so we can save room for all of your questions. I would like to introduce Dr. Urmila Shende, who has led our vaccine campaign for the last 10 months. Next, Dr. Shende.
Thank you, Dr. Mace. And thank you to all the parents who've made time to join us this evening. I have some good news to share with you. Our vaccine clinics are off to a strong start with higher than expected turnouts. As of today, more than 4,600 kids between the ages of 5 and 11 have received their first dose, which is more than 12% of our county's population within this age group. And 62% of 12 to 15-year-olds are now fully vaccinated. We've been working with Sonoma County Office of Education to stand up more than 40 vaccination clinics at local schools to serve people who do not have convenient or affordable access to healthcare providers. We're giving top priority to schools in areas with high rates of COVID infection, low vaccination rates, and large numbers of English language learners. If there isn't a clinic at your school, you can get the COVID vaccine from your doctor or from a local pharmacy. Wherever you go, the vaccine will be available at no cost to you or to your children. Doses for teens and adults seeking their first or second shot will also be available, so everyone in the family, 5 or older, can get vaccinated at the same time. Most clinics will also offer the flu vaccine to prevent influenza this winter. I'm closely monitoring the data on pediatric vaccines, and some clear trends have emerged. The vaccine approved for children aged 5 to 11 is generating an effective immune response without causing significant adverse reactions. The majority of children who receive a shot may have a sore arm for a short time, but otherwise they appear to experience fewer side effects than adults. The most common side effects are fatigue, headache, overall achiness, but less fever than in adults. Since we're talking about vaccination, I should note that the state last week expanded eligibility for booster shots, now making them available to anyone over the age of 18, as long as it's been 6 months since they received their second dose of an mRNA vaccine, or at least 2 months for people who received the one-shot J&J vaccine. These boosters are especially critical for people over the age of 65, as well as people with chronic conditions, or those who received the J&J vaccine more than 2 months ago. If that sounds like you or one of your family members, please do not delay. Please get your booster as soon as the proper time has elapsed since the last dose. I'll stop here for now, but look forward to answering your questions. I'll hand it over to Paul.
Okay, thank you, Dr. Shende. As Dr. Mace mentioned, one of the myths about this pandemic is that some people mistakenly believe that children don't get seriously ill from COVID. We'd like to address that. Our next speaker knows all that too well. I would like to introduce Daveys Katz of Sebastopol, whose 2-year-old daughter came down with COVID and found herself fighting for her life when the virus triggered what is known as multi-system inflammatory syndrome. Davey, thank you for being here. Could you
Thanks for
describe
having
to us what is MIS-C or MIS-C and how serious is it?
Yeah, so it's inflammation of your internal organs. My daughter had inflammation of her heart. It can be your heart, your lungs, your kidneys, your brain, I think, and your skin. She had off the charts inflammation of her heart and a leaking valve in her heart, and got severely sick and was in the pediatric ICU for 10 days.
And when did you first realize that something was wrong with your daughter, and Alma, I believe her name is,
Yeah, Alma. Well, my husband and I got COVID last July, and Alma seemed spared. We felt so lucky. She wasn't really sick at all. She had one day where she took a really long nap, and it kind of seemed like she was fighting something off. But then she was fine, even though she was with us while we were both sick. And then it was about 4 weeks later that she started to get sick with MIS-C. I think it takes anywhere between 2 and 6 weeks for a kid to come down with MIS-C, and for her it was 4 weeks. She had really persistent fevers. That was the main thing that we couldn't seem to suppress with any medication like children's Tylenol. Nothing worked at all. Maybe for a few minutes or something, and then her fevers would just spike up really high. Other symptoms she displayed, she had a splotchy rash on her face and bloodshot eyes, splotchy eyelids, swelling in her hands and feet. She was actually just under 2 when she got sick, and so she couldn't really vocalize her symptoms so well. When I read about the symptoms later, I imagined she had some of them, but couldn't tell us, like headaches and definitely abdominal pain, because it was a few days into her being sick that she started vomiting. And that's when we took her to the ER.
And how is she doing today?
She's doing really well. Yeah, she's
Okay.
doing great. She's fully recovered. They treated her with an antibody treatment, and then she had, when we went home, she was on steroids, prednisone, for a while to bring the inflammation down. And we had to give her shots in her thighs every day of blood thinners for I think about a month.
Yeah, but she's still too young to get a vaccine even now.
Right, we can't wait.
Yeah, so she's still vulnerable in some ways, even though she does have antibodies, correct?
Right. I don't know how long those antibodies last. And I was told by a doctor that she saw that because she was giving this antibody treatment, that getting an antibody test may be inconclusive. The doctor know the answer to that. Is that correct?
That's a great question, Davey. I mean, I feel like a lot of us are, there's a lot of unknowns, because I think antibody tests tend to not always be quantitative. Some of them are just positive or negative. And I think when you talk about like, how long do antibodies last? I mean, I think it's sort of a question on the table, particularly when we're talking about MIS-C. I mean, I think that we're going to, I hope I'm not interrupting. We're going to talk about this, I'm sure, more, but we hope on some level that kids will develop memory and never have to experience that again. But I think that functionally, I think that we have the most data about the vaccines. So I agree with you 100%. I think that the safest bet for her eventually will be to get vaccinated as soon as it's available. I really hope it's just in the next few months. I'm hopeful.
Well, thank you, Brian. So this is Dr. Brian Prestowski, a pediatrician at Sutter Health here in Sonoma County, a very respected physician, and we appreciate you being with us, Dr. Brian. David, and let me just wrap up with you. So how do you feel when you hear people saying that COVID is really not a risk for young children? How does that make you feel?
Um, it's, you know, it's frustrating and disheartening, I guess. You know, it's pretty rare to get Missy, but you don't want it to be your kid.
Mhm.
So, you know, at least I can explain to them that I've been through this. And, you know, I think a lot of people don't know about Miss C to begin with,
Right.
um, because it wasn't COVID that made her sick. It was this reaction, this response to COVID.
Yeah.
And a lot of people don't know about that. So I think it's important to bring awareness to that.
Do you have any other messages that you would give to parents based on your experience?
I mean, I hope they vaccinate their kids. You know, I live in West County and there's a real mix here of people who are for vaccinating their kids and anti-vaxxers. And, you know, I see both sides, but I know that our daughter got COVID because we got COVID. And, you know, if we were able to be vaccinated a year ago, that may not have happened. We got COVID because my husband got it at work and he doesn't have the luxury of being able to work from home. He has a job where he has to go in and, you know, they were masked, but unfortunately they were exposed, and everyone at his work got it. So, you know, we brought it home and I wished we didn't.
Thank you very much for being here, and we appreciate that very much. Dr. Brian Prestowski, what is your reaction when you hear stories like this of Davey, and what are you hearing? You probably hear from parents that are hesitant about getting their children vaccinated. What do you tell them?
Oh, this is terrifying. I mean, Davy's story is just absolutely terrifying. I know when we were kind of just chatting in the introductory to this, just getting to meet, she had said something really important in terms of messaging that even just to give her a little space too, to say, she had just to, I'll prompt her. She had said one of the hardest parts about this, and I think that it's important to be honest as health professionals. She said this is extremely rare, right? MISC, I think there have been, according to the CDC, from the data that I've seen, there's been like over 5,000 cases reported of MISC over the last 18 months. So it's not that it doesn't happen. And for the parents who have kids who experience something like this is, as you said, Davey, this is as real gets, because it's your kid. And I think that you said something really important that I just want to give you space, that a lot of us in healthcare are learning so much about coronavirus and the aftermath. As you said, MISC is sort of like 2 to 6 weeks later. So in many ways, it almost felt, I think you had said, like you had to advocate for your daughter in a system of healthcare at the time that wasn't set up to really serve her. And I want to just be honest about that. I mean, in many ways, at that time, I think, as you said, we were doing a lot of remote visits.
Mm-hmm. Yeah, remote visits. And, you know, I kept trying to have her seen, and they kept insisting on these video calls. And we knew she was exposed to COVID, and we just wanted to get her into a private room to be seen, because it seemed like something was lost in translation. They thought she had a more common virus like roseola because of her splotchiness and her fevers. And I could just tell that wasn't what it was. And then it took those video visits, you know, and describing her symptoms over and over until she was just so sick, like gray, pale, throwing up, that we had to take her to the ER. And then they finally figured it out. So I think that parents need to insist that their kids be seen.
I feel like one of the things that you're saying that's like so crucial in pediatrics, it's a mantra. I know Dr. Shende knows this with me, is that in some ways it's a little bit helpful, but when kids are really sick, it declares itself. You know, it doesn't necessarily go away as easily as something like roseola, where we all hope it's something a little bit more benign. But as we've learned more about COVID, I feel like, and to be honest, there's a lot about COVID disease. I feel like when people talk about like long-term and long COVID, I think we're learning a lot more about the disease as we go. I just want to like be honest about that. Whereas the vaccine, for those of us in healthcare, it just feels like we know so much about this vaccine right now, and it's being interrogated so closely that right now, I just wanted to share too. I got my son vaccinated this afternoon
Yeah, I remember. Yeah, that's
at
great.
Walgreens. I got as soon as I was, but but for the same reason, in my mindset, as Davey was saying about MISC, as I've read about it and I've thought about coronavirus, we'll talk about the risks of the vaccines. It pales in comparison to MISC, which happens to actually be the median age is age 9. So, for the kids 5 to 11, my kid's 7. This is our age range. So whatever I
Oh,
could do.
I'd just like to add, they said that it says that, kids anywhere between 3 and 12 are about, or 14 are about the ages getting it, with 8, 9 being the average. But my daughter was only 1, so you never know.
We're learning as we go with regard to the disease. With
Yeah.
the vaccine, there's just so many more knowns. But thank you for
Well-
giving me space to talk to Davey.
Well, thank you both. And I do want to move into, what are some of the other obstacles that are preventing people from, parents from wanting to get their children vaccinated? And I'd like to address some of the myths. And Dr. Shende, I'd like to bring you into this too. One of the myths we're hearing is that the vaccine can jeopardize people's ability to have children, their fertility. Could you address that a little bit? Are you hearing that?
Oh, yes, we're hearing it quite a bit. Where that came from, it's hard to know, but the studies don't seem to indicate any concern about fertility. I think what tends to happen is that a lot of these kind of myths that get spread on social media are based on something that people are going to be very, very fearful, very concerned about. And they don't necessarily have any basis. So studies that have been done have not borne that out. We know that many women have actually become pregnant after receiving the vaccine. So that in itself is some proof that that's not the case. That being said, it's true that we don't have long-term effects of the vaccine because it's been out for less than a year. But also we know that in the history of vaccine production, if there are significant adverse effects, they tend to be borne out within 6 to 8 weeks of a vaccine having been available. At this point, we have more than 10 months of information about the COVID vaccine. And we have seen that there have been plenty of episodes, instances of fertility. So that's one thing to keep in mind. We have good information at this point, and we have more than 50 to 60 years worth of information about vaccines in general. And so it shouldn't be as much of a concern as is out there. That being said, we understand that people have concerns. I don't know if Dr. Brian would like to add anything to that.
Yeah, I feel like a lot of this, I think maybe even to start, as you said, Dr. Shende and Paul, is that the misinformation campaign is so rampant on social media. And it is very difficult to avoid. And so when people come into the office and say, bravely come in and say, to their sort of trusted health professional, I've read about this thing. I know that you recommend the shot because universally, almost all health professionals are like, please get this vaccine. We don't want you to get hurt from COVID. They're bravely bringing up how confusing it is out there. And infertility is one of the main things that I also, as you said, Dr. Shende, particularly with girls, I think that a lot of the moms and dads bring in their young daughters and say, but Brian, I just want to make sure they're going to be okay in the future. And I agree 100% with everything you said, Dr. Shende.
Well, we're gonna have more of a chance to talk about some of the other myths in a few minutes. Dr. Harrington, I wonder if I could get to you because we want to go to some of the questions from our parents now. And we are getting some questions about just some logistical questions about what specific kinds of documentation that parents need to bring in order to have their children vaccinated. Do they need to bring a birth certificate or proof of citizenship or anything like that?
No, they don't need they don't need to bring proof of citizenship. They don't need to bring proof of medical provider. If they have the information, it's welcome because it helps them fill in the forms faster. The age has to have some sort of verification if they can do that. There's a variety of ways in which you can verify your child's age, but they need to make sure that they are within the age range. The other thing is people need to know what their custody rights are. For example, you could be a joint custody parents, and either parent can give a consent. And children will need to have a parent with them for consent. If they have a custodial parent, that's only one parent has been awarded custodial rights, that parent has that consent. And sometimes we have parents who often give guardianship to a caretaker provider. Well, they need to know that by doing so, that person has rights to give that consent for vaccine. So parents need to know the various consent rights that they have, and they need to follow the one that's most convenient for them. But this is a family discussion, and they should make those decisions collectively as best as possible.
Thank you for clarifying that. And you mentioned there were also some questions about when the vaccine would be mandatory for students. And I believe you said in the preview that that wasn't going to happen till July at the earliest, correct?
Right. And you would have to get FDA permanent clearance before December 31st. That does not seem likely. And we've been in discussion with the governor's office, and his chief of staff said that they are going to project that it will be effective July 1st, 2022. That means for students between the ages of 12 to 17, they will have the mandate on their records. Schools may start anytime recording the mandate on the health record for the students, because we'll have to report that to the state. But that's just a matter of clerical.
Okay, and we have one question. Will parents have the option of doing testing instead of getting their child vaccinated under the state mandate?
Well, it depends on which order it comes up. It's Dr. Shindy could probably describe it better than I, but the health order, it'll probably have some options out. But if it is passed by the legislature, and the pediatricians know this, if it's added by the legislature and put on the mandated list, I think there's only one limited restriction that they can use, and it's usually a medical provider has to give that restriction. So just depends which way it gets placed, if it goes through a health order or if it goes through the legislative process.
Okay, well, that's great. Well, one other question, we're getting a couple, I presume you haven't heard whether boosters will be required for children, students down the road.
We haven't heard, but it seems to be, for those of us who've been through the old polio routine, we had boosters, and you had to get your booster every so often. I anticipate that this shot will have a 2-shot routine and then a booster. Dr. Shindy probably, or Dr. Mace can talk to that better than I.
Yeah, at this point, we don't have any information about the pediatric vaccine and requirement of boosters. I think we're just going to have to wait until we have more information, just as was the case with the boosters for adults. So at this point, no, there's no information that boosters will be required.
Okay. Well, here's a question for Dr. Mace or Dr. Shende. Jamie F. asks, if you can still contract COVID-19 and transmit COVID-19 even when you're vaccinated, why should anyone get vaccinated?
That's actually a great question, because as everybody knows, even if you're vaccinated, you can actually get COVID. The good news is you're much less likely to get COVID than somebody who's unvaccinated, given the same circumstances. And also, you're much less likely to get very ill. So really negative outcomes like hospitalization and death are much, much, much less in the vaccinated group. And you may not be asymptomatic as well. So you may not be as likely to spread COVID to others as well. So there's a lot of benefits to getting vaccinated. And I think, there may be some people actually who are vaccinated and asymptomatic who have COVID as well, which is one reason why we have the indoor masking mandate still, and one reason why we're having people be really careful in terms of gathering still, and make sure that they're being safe. Dr. Shende, you want to add anything to that, or Dr. Prestowski?
Just in terms of numbers, as Dr. May said, if one is vaccinated, there's less chance of contracting, of turning positive. 6.5 times less chance of becoming positive if one is vaccinated. Significant, about 15 times less chance of becoming hospitalized. So even though it's not 100%, we know that there's a significant protective effect from vaccination.
Yeah. And I hate to say, we reported 2 additional deaths in Sonoma County today, and both were unvaccinated individuals. So that's always heartbreaking. This next question I'm going to pose to Dr. Prestowski. Misty asked this. She said, unfortunately, COVID spread through my home recently. My 11-year-old tested positive for COVID, but it was extremely mild. She just had 1 day of fever and fatigue. And my 8-year-old never got it, although she was exposed to 3 positive COVID people for multiple days. What is the recommendation for the vaccine for kids who've, 1, been exposed and mildly got it, and 2, been exposed and never got it? Do they really need to get a vaccine? I think is the fundamental question. What do you think, Doctor?
So thanks for this question, Misty. It's a little bit intimidating to answer this with Davey in the room, because I think that, again, when somebody's been through MIS-C and complications from COVID, they know how real it can be. And it's just hard to even think about kids getting mild kind of COVID and like what could happen 4 to 6 weeks later or 2 to 6 weeks later. So Misty, please stay in contact with your health professional after hearing Daveys' scenario with Alma. When I think about memory against a disease, I like to, I think what we've learned so far is that it's tricky to predict when somebody has either no symptoms or mild symptoms, how long that immunity will last. And I think that with somebody like Alma, who was really ill after getting COVID, I hope that her immunity lasts for a long time. For people who have kind of mild illness where it's just difficult to determine whether, you know, their body is going to really remember that viral load, you assume that the viral load must have been smaller if the amount of symptoms were lower. It just feels a little bit like the more reliable way that I think as a health professional, I could tell Misty what I think would be safest would be for her kids to get vaccinated. And I think that for those who, the kind of rules that are on board when you've been exposed to, or when you tested positive for COVID, are that you're eligible to get vaccinated 4 weeks later. If you haven't tested positive, you could get vaccinated now. So I think that with her kids, you know, it's clearly people had COVID in the house, but if it was mild, you said extremely mild, I think those are your words that I wrote down. Functionally, it makes it difficult for me to say based on that infection that your kids for sure have long-lasting immunity. That's been the unpredictability of COVID from the beginning of all this. Where is there an illness where they either have no symptoms or you're in the ICU or worse? It's just so unpredictable that the vaccine is just the safer bet.
Let me just add one thing. Studies have recently shown that people who have COVID, the antibody production is all over the place. So people may have a very mild case and have significant antibody production. They may have a significant case and have less antibody production. And the duration of protection of the antibody response is unpredictable. So there's no saying that if someone has it, that they definitely are protected for 6 to 8 months. It's highly variable. Whereas the response of the antibody production after the vaccine is quite consistent. So that's one thing to keep in mind. Also, it's important to note when that infection happened. I know that Misty said it was a recent infection, so one can presume it was probably Delta. But people who had COVID prior to roughly July of this year probably didn't have Delta. So if they're banking on that prior infection, they really don't have immunity to Delta. And the vaccine seems to provide a lot of protection against that more recent Delta variant. So that's also something to keep in mind.
Great, thank you. Well, Dr. Shende, while I have you, I want to pose this question to you. Andrea asks, why did Pfizer change the ingredients from the adult dosage, 12 and up, removing sodium and potassium chloride and adding tromethamine, which is generally used to stabilize heart attack patients. Do you have can you explain that?
Yeah, there's been a lot of concern about this. Tromethamine, or tris, is simply a buffer that's used in many different vaccines. It's used in the smallpox vaccine. It's used in Ebola vaccine. It's also used in various products like cosmetics. It itself is not a treatment for heart conditions. It's just something that's used just like normal saline is used when somebody enters a hospital for any reason. But the reason that this change was made is because it extends the stability of the vaccine. Before that buffer was added, the COVID vaccine could only exist in a regular refrigerator for about 4 weeks. Now it can exist for 10 weeks in the refrigerator. And that makes a big difference when storing a vaccine with other pediatric vaccines. So that's the big reason. And that change is going to be made to all Pfizer vaccines starting next week. And it's used in Moderna vaccine as well.
Great, thank you. Dr. Mace, I'm going to direct this next question to you. We're getting a number of questions about the data on the CDC's VAERS system, which stands for Vaccine Adverse Event Reporting System. Could you explain what that system is and how accurate it is in terms of collecting data about the vaccines?
Yeah, thanks so much. The Vaccine Adverse Event Reporting System is a database that all around the country, when there are any kind of adverse events, even small side effects, like a rash, that the physician or the public health department can report that in the system. Then CDC, that's our national public health program, will look through the database and decide whether there's certain adverse events that have been reported that they need to investigate. And then they'll proceed and reach out if they need to review any records or follow up with any particular adverse events. And it's a huge database because everything gets reported. Even a very mild side effect that's seen by a physician could be reported. But it's very comprehensive. And if you go into the system, it's publicly available information. You can see all the different kinds of side effects that have been reported. Luckily, with the COVID vaccine, we've had very few reports of significant adverse events. Just the usual mild sort of symptoms that we see have been reported.
Well, thank you. Well, speaking about the effects, there have been also some questions about myocarditis. Could you and Dr. Shende address what is myocarditis and what is the risk there that you know of?
So myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the lining of the heart muscle. And we know that myocarditis happens with many different illnesses, many different triggers. It's very common with viruses and with bacteria. And in fact, there's a seasonality to it. This is completely separate from COVID or COVID vaccine. It just happens more so in the spring, and it seems to happen more in adolescent males. There's thought that it may have some relation with hormones and adolescence. So in terms of myocarditis from COVID, we know that people who get COVID, if they get myocarditis, if they get COVID, they have a much higher chance of getting myocarditis. The numbers are in the range of 6 to 30 times higher chance of getting it compared to getting it after the vaccine. When people get myocarditis after any kind of an illness, whether it's COVID or a virus or a bacteria, we know that those effects are significant. It can affect the heart for a long time. It can be very, very serious. It's similar to what Davey was describing with MIS-C. When people get myocarditis after the vaccine, that doesn't seem to be the case. We do tend to see it. It tends to be in teenagers. It tends to be in teen boys. And it tends to be after the second dose of the vaccine, and usually within the first few days, within the first 4 to 7 days. But what we found is that kids who get myocarditis have a pretty mild case. Oftentimes they're admitted to the hospital, they're monitored. They oftentimes will be put on Advil. They, in rare cases, might need oxygen, but for the most part, they are fine and they're released within a couple of days. Sometimes it may take a week or two, but the vast majority have completely recovered. So very different than getting myocarditis from an illness, and particularly from COVID. So there's concern, but it's important to look at the relative risks. And we know that the risks are much higher with any kind of an illness, particularly with COVID. But that from the vaccine seems to be quite minimal. So I don't know if Dr. Prestowski or Dr. Mace want to add anything to that.
Well, one thing just that Davey had said, just to go back when she was talking about what MISC and what COVID disease, as you're mentioning, Dr. Shende, can sometimes, how it can impact the heart. When you said, Davey, that your daughter, while she was in the ICU, had even had like not only inflammation of the heart, but she had also had some valve problems. I was reading about all of this stuff, you know, we're again from coronavirus disease, from MISC, that it's possible. It just really seems like the risk of getting, if you were like just looking at kind of heart risk and looking at what can happen from COVID and MISC, as Dr. Shende was saying, compared to like the really rare risk of any sort of somewhat mild benign course from myocarditis from the vaccines in a very select group of like adolescent boys. I think Davey's daughter really is a great unfortunate example of like how unpredictable this can be. But when you said that she had to be on blood thinners for a month afterwards to make sure she didn't get a clot, and you had to inject was it Lovenox or in her leg?
Yeah.
Just sounds like that's why my son got vaccinated today. I was thinking about your daughter. I was like, I don't want Sal to get MISC. So this is gonna, if this works to keep him healthy, it's totally worth it. Davey, I'm so glad that you're here today to share that story.
Thank you. I just wanted to add that, you know, although she fully recovered from MIS-C, because it's a new illness, we still don't know the long-term effects of how it's going to affect her. Hopefully it won't, but we don't really know, right? Because it's new. So, you know, if you read online, there's this rare thing, MIS-C kids are getting it, but they almost all fully recover. That's, you know, you don't know the long-term effects, and you still don't want them to go through it to begin with. And, you know, there's a lot of trauma for her around that illness. And like, you know, she had a lot of fear for months about people that looked like her nurses, and behavioral stuff comes up with kids because, you know, she wasn't a very developed person yet. So that was a big part of her life.
Yeah, thank you. Thank you, Davey. Dr. Brian, you mentioned today you had one of your children vaccinated. What are some of the more usual side effects that we see when children are getting their shot? The sore arm. What else do you see?
Yeah, I feel like you know, it's for kids that are 5 to 11. It's only been a week, so for my patients who've been able to get into Walgreens or Rite Aid or CVS or get into one of these amazing school-based clinics that Dr. Harrington was talking about. Thank you so much for organizing those for these kids, particularly the kids who, as we were saying, have difficulty with taking time off from work for the parents. You know, if you make it as convenient as possible, access is such a big deal. Side effects wise, Paul, I mean, kids are so used to getting shots. You know, a little bit of sore arm, maybe some, as Dr. Shende said, low-grade fever, but because the dose is a third of the adult dose, we're just seeing, I expect to be seeing fewer side effects. Most of the kids actually, I know that this is kind of the first third of parents and the kids who've been so excited to get vaccinated that the kids, all I see are these pictures of them with the kind of Rosie the Riveter and the Band-Aid, and it's just like this awesome elation and relief that I feel like is a much more overwhelming side effect that's a desirable one than some of the sort of less issues that I think everybody's used to tolerating with shots.
If I could just add one more thing, at the pediatric clinics at the schools, we've been working with a lot of the community-based organizations, and they've done a great job of making the clinics very enjoyable, shall we say. This might be the shot that kids enjoy the most, because they've got face painting, they've got coloring books, they've got treats there. they don't usually get that when they come in for their pediatric vaccine. So hopefully this will actually be a positive experience for many of those children. And we really thank the community-based organizations for all their efforts. Daveys and Cura and LSP have done a great job of making it kid-friendly and helping to reduce that anxiety that's natural.
So one of our viewers asks about that she says that her child has allergies and they're hesitant about getting a vaccination. We've heard from a couple of people who have allergy concerns. Should that be a concern for parents of children who have allergies?
So the only significant definite contraindication, meaning reason to not get the vaccine, if somebody has a specific allergy to polyethylene glycol, PEG. That is actually the active ingredient in Miralax that many kids are very familiar with, and their parents as well. It's used for treatment of constipation. It's unusual to have an actual allergy to that ingredient. However, people who have a history of significant food allergies or allergies to medication, the only word of caution is that those children should be watched for, instead of 15 minutes, they should be watched for 30 minutes to make sure there's no reaction. Interestingly, anaphylaxis or an emergency reaction to a vaccine was really a concern at the very beginning. Remember back in December of 2020, that was like the big concern. It's turned out that with millions of doses given, there have only been about 20 to 30 cases of anaphylaxis. So it hasn't really been a significant issue at all. So yes, it's good to be cautious, and it's good to wait for 30 minutes if there's a significant history of reaction of allergies, but it's generally not a contraindication.
And several people have made reference to natural immunity. That could you explain what is meant by natural immunity, and does that mean that one who has natural immunity does not need a vaccine? Dr. Shende or any of our doctors?
I'd be happy to answer that. So definitely when you get any kind of a virus or bacterial infection, you do make some antibodies against it. The difference is that it just depends on how long those antibodies last and how effective they are. So we know when you have the vaccine that you're getting a certain type of antibody against something called the spike protein, which is part of the virus that helps that virus invade your body and your cells. And the antibodies that are made then are made against that protein specifically and are very effective. And that's why we see such a great efficacy of the vaccine. Now, when you actually get COVID infection, you get different kinds of antibodies, and it's very variable, as Dr. Shende had said, in terms of how much of an antibody response a person has, and then how effective those antibodies are to keep you from getting infected again. We know they're not as effective as antibodies from the vaccine because we've seen a lot of cases of people who get COVID a second time around. In other words, that we have definitely seen that. So there must be some protective effect of having antibodies from infection, but there's no natural immunity, so to speak. The immunity is really what we see from the vaccine, and that's why we're really hoping that everybody will get vaccinated.
And that comes back to the issue that just because you've gotten COVID you still need to get the vaccine.
Exactly.
So whether you're a child or an adult. Dr. Brian, a few of our viewers have made reference to a story today about there was a Sutter hospital in the Antioch area in the Bay Area that inadvertently gave children adult doses of the vaccine. And a number of our listeners are concerned about that story. Is that a problem, a common problem? And I guess what measures are in place to prevent that from happening? And what are the risks? You have some thoughts on that?
Yeah, thanks, Paul. You said there were several listeners who had commented on that.
Yeah.
I feel like this is the first week of giving the pediatric vaccine, and it's a different vial, it's different needles, and it's a different dose. It's even a different color. So, I think when errors happen like that, I feel like when we're trying to learn, it's an error. I would encourage parents to make sure, double check, when your kids are getting the vaccine, that you can ask, hey, my kid's 5 to 11 years old. this is the orange vial, right? Of the Pfizer vaccine, and just make sure you can advocate for your kiddo and that everything is going according to plan. From what I've heard, if people get the 30 microgram dose or in the 5 to 11-year-old range, you don't have to repeat the pediatric dose. It's not like you have to get the 10 microgram. It just counts as one dose. And then you would still, in the second interval, try to get the correct dose. One kind of in between, I think a lot of parents have asked, what if my child is 11 and they're turning 12, which would be kind of not an error, but people would be like, what do we do? You know, do we wait for when they turn 12 to get the bigger vaccine, the bigger dose at 30 micrograms? And in the Pfizer trial, they had the kids who were under 12 at the onset of the trial still get the pediatric dose, even if they turn 12 for their second dose. So whatever you start with, get the second one. These in between cases, it's so sad to hear, Paul. I feel like as we get better at this, hopefully everybody will be able to identify. But parents, please advocate for your kids and make sure that when you're talking to your health professionals, that you can kind of make sure that they're also aware of all of these possibilities, because a lot of this we're all learning a lot as we go, which is really important to be honest about.
Okay. Well, that's going to be the end. We're reaching the top of the hour, so we're going to wrap it up now. Anybody have any final thoughts they'd like to share today before we sign off? Well, we again, we want to just thank everybody, all of our panelists for joining today. Thank you to all our viewers and for the great questions that were submitted. And we'd like to thank our crew who helped put this all together, and especially we'd like to thank Mari, our Spanish interpreter, and Elizabeth, our ASL interpreter, for being with us today. We will be repeating this webinar in Spanish tomorrow. We have some native Spanish speaking panelists who will be joining us at that time, some healthcare professionals. So please pass the word. We also encourage you that if you have questions that we didn't address, we have a lot of information that are available on socoemergency.org/vaccine. That includes information about the vaccine and clinics. You can also go to scoe.org/vaccines to learn more about the Sonoma County Office of Education vaccine clinics and around the county. So we thank you again for being with us. Have a good week and stay safe, everybody.
Thank you, Davey, for coming. It's so important.